Okay, good evening and welcome. My name's Som Jandu. We're going to talk about the bowel nosodes and a practical guide and how you can use these in your practice, pretty much effective after today. But before we begin, I'm going to tell you a little bit about our college, the College of Practical Homeopathy, and how we structure our course content, and you can see how things fit in. Yes, we teach homeopathy. We're one of the longest established colleges in the world, as well as the UK, of creating professionally licensed practical homeopaths. So homeopathy is at the heart. We do teach nutrition, herbs, supplements, tissue salts, bowel nosodes, subject for today, flower essences, meditative provings, and mindset. Things often start in the mind and manifest through the body. So that's how our course is different to every other college in the world. And so I'm very honored and pleased to have not only been a student at this college, but now as the owner and principal of it as well. Just to let you know, our split of students, beg your pardon, two-thirds, 60% are postgrads. They come from other disciplines. Some are even homeopaths wanting to advance their knowledge. Other people, craniosacral, osteopaths, doctors, nurses, massage therapists, shiatsu, Reiki, chiropractors, you name it, will come and learn about the homeopathy and how it can add on and bolt on to the services they provide to their clients. We talk about something here, and we will talk about this today as well as we progress on the bowel nosodes. At CPH, we call it the 3 T's of disease. Patients come to us with their symptoms. We know this, you guys know this, you deal with it every day. But what we teach you is etiology before symptomology. The reason being, we say that signs are the symptoms are the signs of the body, and disease is the dialogue of the body. So our aim isn't just symptomatic relief, because in a way we're telling the body to be quiet. We want to listen to it and say, what are you trying to tell me? And how have you gone from a position of wellness to ill health? So the way we work is always aim to discover the cause. And as we progress on this conversation today about the bowel nosodes, we will see that we can link a causation and a way of being to a way of presenting. And as you see your patients and your clients, you'll get to understand them, hopefully, in a slightly different way and perhaps even in a deeper way. So when they come, we say the 3 T's. What is the first T that they have? Trauma, bottom left of this triangle. Have they injured themselves? Have they traumatized in any part of their body? This is not mental trauma, physical trauma. If it's that, we can deal with that acutely, chronically, etc. Some people have a trauma, they've injured themselves years ago, and it's manifesting now. If it's not a trauma, we say, is there toxicity in the body? This is your area of expertise more than anything else. As I've just learned, it's not just about hydration and irrigation, it's about other things and detoxifying and moving things along. And the toxicity could be environmental, occupational, recreational, allopathic drugs, you name it. If there's something happening into, within, and to the body, and it's causing toxicity, that can cause the symptoms. So with symptoms are the last thing we look at. We look at the causation. If it isn't a trauma and it isn't toxicity, it will be a thought. So the other thing we talk about at CPH is that the body never lies. The body doesn't do symptoms for the sake of it. So the question is, are we listening? Once we've determined the cause of these symptoms, we have a flowchart. It's in the books that we sell, page 32 of our book. We have different methods to help the person on their journey back towards health. If you're not homeopath, this won't mean too much, but the flowchart helps us identify one of 15 methods of homeopathy that we teach here. For those of you who are aware of homeopathy, you're probably familiar with this thing on the right-hand side called classical homeopathy. And like classical music, it's wonderful and beautiful, but it's one aspect, one genre of music. This is one genre of practicing homeopathy. The remedies are the tools. How we apply them and how we use them lets us create this whole orchestra of wellness to support the body. We also teach our students this Chinese 5 elements observational chart. This is amazing because it's over 5,000 years old, and the Chinese medical practitioners didn't believe in autopsy. They understand energy that flows through the body, permeates everything, and alters states, physical states, mental states, and manifests in disease states. We're not going to dwell on this, but with the audience we have today, let's focus on the bottom right-hand side of this chart down here. We have the lungs and the large intestines. These are called the yin and yang organs, and you'll notice they have a time modality. So according to Chinese medicine, this is when energy flows through these particular organs. Or as I like to say, this is when these organs dip into the universal flow of energy and replenish themselves and strengthen themselves. So when a person has an aggravation at these time zones, and you can see different organs have times, that tells us there's a weakness in the energy of that organ. The thing with yin and yang organs, lungs and the large intestines, they govern the respiratory tract, the skin, and the hair, and they open through the nose. We'll ignore the element in this instance because we're not studying the five elements. But the emotion tied to this is grief. So, if I have someone who comes to me as a homeopath and says, Som, I'm constipated, I know that there's going to be something to do with grief in that person's timeline, in their case history, once I've determined it's not a trauma or a toxicity as part of the three T's. They may come to me with issues in their lungs, asthma, bronchitis. The hair might be falling out. They may have eczema. And we know that this is all linked to grief. We also know that sometimes when the body's congested and backed up, it can purge through the largest organ, the skin, and create toxic skin. Sometimes people call it leaky gut syndrome. It's the body purging. It's got to find a route of elimination. So we have found that this 5,000-year-old system of observation is a fantastic tool to help us ask the kind of questions we need to ask to get to the underlying cause so that we can treat it. So they will present in any one of these. And as we teach here at CPH, we say the issue is not in the tissue, but the tissue is manifesting their issue. For example, someone with grief could present with hair falling out, issues with the respiratory tract, issues with the skin, issues with the large intestines, or even issues with the lungs. They are all linked to grief. And that allows us to say, look, when are you going to tell me about the things that have happened in your life that have made you sad? And that opens up a wonderful discussion. So that's one of the tools we use. Now, we're going to try and apply some of that as we talk about the bowel nosodes. The nosodes are remedies which are derived from the products of diseased tissue or pathogenic disease-creating organisms. In homeopathy, we have something called a sarcode. That is a remedy produced from an organ that is perfectly functioning. So think of homeopathic remedies as energetic information. A bit like a serial code or a channel that you tune your satellite TV into. You tune in, you will receive that picture. You tune into BBC News or Capital Radio, that's what you will receive. So these remedies send this vibration to tune our body back to wellness. Also, another way of thinking is like a tuning fork will send a vibration and tune a piano. We can't see this, we cannot touch it, but it can touch us. The bowel nosodes are remedies derived from the culture of intestinal bacteria. So they culture them, then they're potentized. Potentizing is a way of taking out the physical fecal matter, getting the bacteria under the microscope, succussing it and getting the energetic information of that bacteria, and then giving it back to a person with the same disease and finding that it cures that very condition. Why? Because when we have different conditions in our body, you guys will know this better than even I do. Our gut flora is changing all the time. We can introduce new bacteria in. New bacteria can form as a result of our exposure to environmental toxins, even our emotions. People call it the gut-brain axis, correctly so, because the gut came first. Our bacteria make our neurotransmitters. It's nice the allopaths are finally accepting that truth. They talk about the dementia, Alzheimer's, degenerative diseases, and they now started to understand the value of probiotics that create the very neurotransmitters we need to function. Nosodes in homeopathic practice are used to overcome obstacles to cure. Sometimes a homeopath will give a remedy for a condition. It's the right remedy, they've done their work, they're licensed, but they have a block. And then when you give a bowel nosode, it clears the way, literally, all pun intended, to get things moving along energetically and physically. And one of the most significant obstacles to cures that you guys deal with every day is intestinal dysbiosis. There's an imbalance in the flora and fauna of the flora of the gut. And this undermines the patient's ability to respond to any treatment, even conventional treatment, drugs, herbs, because they cannot assimilate and digest and absorb what they're being given. And this then can lead to further, more complex patterns of illness that manifest in other organs than where it started. It permeates through the body. So they're very, very important things to be used. A great adjunct to your treatment. Some of the indications that they can cover: outbursts of emotions, especially anger, mental and physical fatigue, weakness and cramps, congestion of liver, blood, the venous system, varicose veins, malnutrition, skin eruptions, arthritic conditions, nervous strain, anxiety, depression, apprehension, anticipation, allergies, and another thing we're seeing increasingly so, poisoning and toxicity. So we're going to explore these a little bit further now. The historical overview: some of you may be familiar with Edward Bach of the famous Bach flower essences. He's at the Royal London Homeopathic Hospital, and he was investigating autologous vaccines. He joins there, finds them out, then he realizes that there's bacteria as well, not just viruses. Okay? And he was helping people develop this. Then at the same time, almost in parallel, Alexander Fleming identifies penicillin and says that this can break up staphylococcus infections. So this caused a massive boost into the bacterial and germ theory that permeates everywhere now. And then 2 years after that, John and Elizabeth Patterson started to investigate bowel nosodes. They took this knowledge and said, what else can we do with it? And they're the ones that explored, cultured, potentized, and wrote their findings of the bowel nosodes. So they've been in use for a long, long time now, 100 years. And Elizabeth Patterson, after her husband passed away, publishes her research in the British Homeopathic Journal, a very well-known journal. You might do a Google or AI search for it. Just as prestigious as the BMJ and the Lancet, but now, due to allopathic medicine, declining and hard to get hold of. If you can, they're a goldmine of information. The development of the human intestinal flora, as many of you know, a fetus has no bacteria at all. It's not till the first trimester has passed, the second and even the third trimester, that the gut-brain axis starts to form, the neurotransmitters start to form, movement occurs in the body. But after birth, the first part of colonizing the body is passing through the birth canal. There's rapid colonization. And then by the time a child is 2 years old, its intestinal flora is very, very similar to adults, unless affected by vaccines, treatments, drugs, formula milk, etc. Because the other way of getting good bacteria is through mother's milk. And as that changes through the generations, we are now dealing with generations who are not as robust as the previous generations. They're toxic, they're weak, they're more susceptible to illnesses. Other factors, as you well know: stress, diet, surgery, and the conditions that you deal with every day for what you do, the pathogens. How do we guide people use bowel nosodes to our homeopaths? When there's a group of remedies, homeopathic remedies, and the practitioner cannot decide which one to use, or if there's no clear picture of which is the superior remedy, the nosodes can literally clear up the picture to allow the presenting symptoms to show more clearly, that the homeopath can say, right, this collection of symptoms leads to this remedy, and make a better selection or a more accurate prescription. They can also be given when the indicated remedy fails because there's an obstacle, the bowel. And this is the important thing that we teach here. Can be used to open up the bowels as a route of elimination, of which there are four: respiration, perspiration, urination, defecation. So we always teach our practitioners, if they are not peeing, pooing, sweating, and breathing correctly, don't try and detox them or move them to health, because their body functions aren't functioning first. And this is where your therapy area is so, so important in the health of humans. It deals with one of the greatest, largest routes of elimination. Other than, if they're not, they're literally backed up, pushed up, purging through other organs. This is how important the large intestines are to the health of humans. I don't have to tell you guys. But today, we're going to focus on the personalities and the keynotes of the bowel nosodes. Homeopaths will call this keynote prescribing. We're going to go through themes. We will talk about how it can manifest and help the diseases you'll see, but the personalities alone can help you nail down straight in to which nosode you may use. First one is called Morgan Pure. The keynote is in purple there, congestion. They present this way. They're blocked, bunged up, backed up. Everything's stagnant. So they cannot communicate their words and feelings properly. They seem a bit hazy. They're anxious about their health and well-being. They also have a fear of crowds. Congestion of any kind, it just boxes them in. You'll see your people present this way, and you immediately think, I need the one that is used for congestion to open them up. And as we talked about earlier, it's one of the most important skin remedies. All the skin conditions can be cleared with Morgan Pure just to move things out, because once you move things out, you have a clear out that allows the body to then start to detoxify. And all of our body systems are prone to congestion: venous congestion, varicose veins, liver congestion, congestion of the alimentary canal, etc. And you can see some of the conditions that it's useful in: gout, vertigo, headaches, stroke, thrombosis, clots, piles, fibroids. Some of these conditions are contraindicated for the type of treatments you do. So imagine using this to help clear your case and tell your client, come back in a few months' time and we'll carry on and progress. So this can be a great adjunct to the way you practice. For those of you who may be familiar with homeopathy, we have related remedies at the bottom: calc sulfur, graphites, sulfur, and natrum sulfuricum. Sulfur is a great remedy. Its keynote is congestion, and it has a centrifugal force. It purges through the skin mostly and pushes toxins out, specifically when the bowels are congested. So for those of you homeopaths, you already know this. For those of you who aren't, you can start to make the links between remedies and bowel nosodes. We have another remedy called bowel nosode called Morgan Gardner. These are people who are acidic, inflamed, and critical. So start thinking about ulcers, ulcerative colitis, things like this. And they come across in their personalities as blunt, very direct. And you're thinking, crikey, I can barely bond with this person and I have to do a procedure with them. So their personalities alone will tell you. Why? Because the gut bacteria create the very personalities and control the human. But it's a chicken and egg. But also, as our moods change, we create and grow different strains and cultures in our gut. So it's a very symbiotic relationship. We all know that we are two-thirds bacteria and one-third human cells. So there's an imbalance here. So this is the importance and how important gut bacteria, intestinal flora is to our overall well-being. We are literally two-thirds bacteria. So this is how much influence they have on our personalities. These people are bossy, jealous of other success, self-absorbed, self-pity. It's all about them. And they have an aggravation time of 4 to 8, either in the afternoon or in the early hours. And when we looked at the 5 elements chart, the early hours are the times of the intestines. Lycopodium is a fantastic remedy for things like hiatus hernias and inguinal hernias. So these two often combined together are really, really good for gut issues. Lycopodium is a great, great remedy, not just Morgan Gardner as a nosode. It's often used. The keynote of lycopodium people, they're anxious, they're irritable, and they're full of gas and bloat. And they will say, as soon as I eat something, my stomach swells up, but I can't go. So this should open up your fascination with homeopathic remedies to add to your repertoire of treatments. And as you can see here, they're useful in GERD, almost as specific for that. GERD isn't just too much acid in the stomach. It's also a weak esophageal sphincter. When that is weak and open, when the stomach churns to digest the food like a washing machine, it splashes up acid and we get that acid reflux. So lycopodium helps to strengthen the esophageal sphincter, thereby calming GERD down. It's not about producing too much acid. We're all getting older. How many of us have produced too much of anything as we age? We often don't produce enough. So that's an interesting concept to think about. It can help with impotence, issues like this. It's a big, big remedy for impotence, but you clear the way with Morgan Gardner. skin issues, and you can see the other remedies beneath. Proteus, a fantastic remedy. Think of the Incredible Hulk, turn on a coin. We might know people in our friends and family circles who have these personalities. So why don't you start thinking of people you know, thinking, I know someone who's a good candidate for this nosode, and give them the nosode and watch their personalities change in a matter of weeks and months. That's a great way to get familiar with these. Nux vomica is a remedy, great for overindulgence, toxicity, poisoning, hangovers, eating too much at Easter, etc. But Nux vomica is also an angry, angry, angry remedy as a homeopathic remedy. Nux vomica on a bad day is Proteus on a good day. This is how severely angry and they can just turn on a sixpence, boom, and they blow in your face. Stubborn, domineering, my way or the highway. They bully you, they bully everybody, they're aggressive. They might come into your practice, bossing things around, not really listening. But we have a job to do. So we look at that and we say, okay, Proteus, I recognize you, I see you. So if I give you this gut, it will calm this gut bowel nosode. It will calm your nervous system down and make you chill out. And look at the sudden conditions, the epilepsy, the cramps, the convulsions, things that come on and overtake your body. Reminds you of Bruce Banner in The Incredible Hulk. Once he's angry, there's no turning him back. That's what these are like. Suddenness, surges. So when anyone someone comes to you and says, this happened to me all of a sudden, think Proteus. Mutable, the E. coli, derived from E. coli. Changeable and full of anxiety. The word alone, mutable, tells them 1 minute I have this condition, next minute I have that condition. I can't cope with life. I don't know what to do. Shall I do this? Should I do that? Your clients coming that way, they lack the neurotransmitters to make a structured decision. Remember, these bowel nurses were potentized from actual bacteria that created neurotransmitters that created these personalities. So this is working in reverse. Give that to modify them back to a state of well-being. Anxious, fastidious, OCD, obsessive compulsive disorder. For them, life has to be just so and perfect. Why? Because they're full of fear. Antibiotic overuse is very, very important. Now, you guys know how important it is not to have too many antibiotics. They can cause constipation. They can totally obliterate your gut flora. And at CPH, we tell people, whenever you have a client who's taken an antibiotic, ask them to please take a probiotic at night when they sleep. Why? Just like we make yogurt overnight in a warm environment, if you take a probiotic at nighttime, there's no food, not much saliva going into your gut. The bacteria can multiply effectively to be then obliterated by the antibiotics the next day. But it creates them at a negative starting point rather than depleted starting point. Because when you deplete the bacteria too much, it leads to all sorts of other conditions. It can also cause fungus to grow, as you know. Chilly, flatulent, bloated after eating. Complements lycopodium perfectly well. Pulsatilla is a good remedy as well, homeopathically, for people who cannot digest fats. People have trouble with bile, a blocked bile duct, and the gallbladder not producing the bile needed to emulsify fats. So pulsatilla is a great remedy for that. Mutable is a great nosode that complements that. Bacillus number 7, a fantastic remedy. Think of an iPhone that needs recharging, or any smartphone, shall we say, that needs recharging. Flat battery, worn out, depleted. They come to you, they can barely move. They're absolutely exhausted. Fantastic nosode for that. It perks them up. Apathetic. Life has no purpose. I can't be bothered. Why am I even here? This doesn't work. Doom and gloom. And the conditions this is useful in are some of the conditions that are the hardest to treat conditions, even in Western medicine or conventional allopathic drugs. ME, chronic fatigue syndrome, which often leads to fibromyalgia, and fibromyalgia often leads to death. Alzheimer's and senility. So this is a really big, big nosode to use. And as we grow older, we're seeing a lot more of this prevalent in society. Bacillus number 10. Now, this is a good one, poisoning and trauma of every kind. poisoning from too much alcohol, too many drugs, recreational, too many allopathic drugs, poisoning in people going drinking chemicals in a laboratory, etc., etc. This will clear it out. But also the mental trauma. This is the interesting thing here. Inhalations of toxins, but the second one here, internal trauma, rape, operation. Even if you go to the dentist and you're traumatized by them prodding and poking your teeth with a needle or a scalpel or a little scraper, this can cause trauma to a lot of people. Bacillus number 10 is great for calming this down, great for the after effects of this as well. It's a great worry remedy. They all are actually. Gartner, malnutrition, allergies. Big, big one for IBS, celiac, and Crohn's, where we can't assimilate food because the villi are not right, the gut motility isn't effective, it's stagnant. Um, what are they called? Laxatives don't work. This is a great remedy for that. But people who are fixed, they cannot adjust and try new things. Mentally fixed, physically fixed, too many restrictions in life. Can't do this, can't do that. Allergic to milk, allergic to cat hair, hay fever. They're all over the place. They're hypersensitive to everything. This is a great one to calm their adrenal and histamine response down. ADHD is also hypersensitive, hyperattentive. They've got a short attention span. So when you see people acting this way, you think of Gartner and think, okay, I need to calm this person down. And again, useful in antibiotic overuse and poisoning. Dysentery. This is an interesting one. The abbreviated name for dysentery is called DISCO. DISCO. This is anticipatory anxiety. People are always worried that something bad's going to happen. They come to you full of anxiety and fear and worry. What about this? What if it doesn't work? What if that happens? What if I rupture my colon? What if? Just give them dysentery co, boom, and say, come back next week and watch it work. Nervous wrecks, worry warts, stress head. But a good condition, postnatal depression, fibroids. So when you see these conditions, you think, oh my goodness, they're coming to much more than just stagnation now. And you can tell them that this could help with this should you have it. That opens up a whole new discussion. Enuresis when anxious, overstimulation of the bladder. And they've got the related remedies in homeopathy, which are the key anxious remedies. Then we have psychotico. We had dysenterico and psychotico. Irritable, restless, nervous, biting their nails, fidgety. And this is the keynote of this one. Everything is worse at night. Restless, cannot sleep. I'm tossing and turning. Why? I just don't know. I'm just worried. Mucus and synovial conditions. Nasal polyp, sinusitis, catarrh, irritation of the airways. They cough and bark like that because they can't quite get anything out. And the entire GI tract. And look how it manifests in the symptoms. Cystitis, balanitis, urethritis, itis. So that tells us they're irritable and they're inflamed. So again, we've got some key remedies there. And the last one we have, I love this one, fecalis. Sounds a lot like feces. They're inflexible. They won't budge. They're stubborn. Nope, 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 nope. Nothing will work. You can't tell them. They know best. Literally part of my language, but they're full of you know what. They're full of fecalis. It's a great, great remedy. Great for piles and more for gradually developing ailments that creep on upon them over time, months and years. So we can start seeing these pictures of these people now and seeing how we're going to use them to help. This is the biggest thing that we do here at CPH and how we use bowel nosodes than every other practitioner. We have remedies for the symptoms, but when they come in with these personalities and you use them, you'll be writing to me and telling me how miraculous they are and how they work. There's a little table at the end that we can use right away. Take a picture of it, take a note of it. We have the nosodes, we have the keynote, and we have the main remedies that are associated with it. I'll leave that there for a minute. I think we will share this slide with you guys so you can use it later for those of you who are attending. almost a crib sheet. And we're going to have some questions now. Thank you for listening. My name's Tom. That's the college website. That's my personal email. That's my personal number. But before we go into a discussion, I think we have our hosts, Roger and Lise. I'm going to stop the recording first, as per their request.
Thank you so